Have you been taking a medication that seems harmless every day, but is actually quietly making the blood flow in your legs worse over time? Have you noticed that your legs often feel cold, numb, or cramp up at night? If you're over the age of 60 and currently taking medication for blood pressure, heart disease, or even prescription allergy drugs, then you might be in a high-risk group that even doctors don't always clearly warn about from the beginning. This is a little-known fact, yet it affects millions of older adults every single day. In today's video, I want to share with you a completely different perspective. We will go over 5 very common types of medication that many people take daily, but that may unintentionally reduce blood flow to the lower limbs. This is not a video telling you to stop your medication immediately. Instead, it's meant to help you better understand the link between medications and your vascular health, so that you can have a more informed discussion with your doctor and explore safer alternatives. If you've ever felt your legs are unusually cold, pale, or prone to tingling, this video may help you uncover a cause you never expected. We won't simply list medication names, we'll explain how they impact your blood vessels, refer to real medical research, and suggest safer options you can discuss with your physician. Don't skip this video if you want to protect your legs and your health in a smarter and more scientific way. Beta blockers. Let's start with a group of drugs very familiar to older adults: beta blockers. You may have heard of propranolol, atenolol, or metoprolol. These are commonly prescribed for high blood pressure, heart conditions, arrhythmia, and even for migraines or anxiety. At first glance, these medications are life-saving, and they absolutely are, in many situations. However, for individuals with poor circulation in the lower limbs, beta blockers can worsen the problem. That's because these drugs work by slowing the heart rate and reducing blood pressure, which lowers the amount of blood reaching the extremities, especially the legs and feet, where circulation may already be weak. A study published in the American Journal of Clinical Medicine found that patients taking beta blockers had lower blood flow to their legs compared to those not on the medication. This effect was especially noticeable in adults over 65 and those with a history of claudication, a symptom of leg ischemia. If you've started experiencing cold legs, numbness, pale skin, or nighttime leg cramps after beginning a heart medication, beta blockers may be one contributing factor. That said, this does not mean you should stop the medication right away. The important thing is to speak with your doctor about your circulation. In some cases, your physician may switch you to another type of drug with less effect on peripheral blood flow, such as an ACE inhibitor or an angiotensin receptor blocker, depending on your overall condition. You can also support better circulation by adopting healthy habits such as slow daily walks, foot massages, and staying well hydrated. Carefully tracking how your body reacts to medication changes is also important. Take notes on any unusual changes and bring them to your next checkup. These details can help your doctor adjust your treatment more precisely. If this information is helpful, think about this. Are you or someone you know currently taking a beta blocker? Watch for any connection between the medication and leg discomfort. Feel free to share your thoughts in the comments. You might be helping someone else recognize a problem they didn't know they had. 2. Hormonal medications. Birth control and HRT. When we talk about medications that affect blood circulation, most people don't think of hormonal drugs like birth control pills or postmenopausal hormone replacement therapy. Yet these medications can increase the risk of blood clots and reduce overall blood flow, including to the legs, which are especially vulnerable to poor circulation. Combined birth control pills that contain estrogen and progesterone, as well as synthetic estrogen used for treating hot flashes, insomnia, or osteoporosis, can increase blood viscosity. When blood becomes thicker, it has a harder time moving through small veins and capillaries in the legs. This is especially dangerous for those already at risk, such as individuals with varicose veins, diabetes, or sedentary lifestyles. According to a study from Harvard University, women using postmenopausal hormone therapy were found to have a 2 to 3 times higher risk of developing deep vein thrombosis, a dangerous type of blood clot that typically forms in the legs. These clots can cause pain and swelling, and in some cases, may travel to the lungs and lead to pulmonary embolism, a life-threatening condition. In older adults, blood circulation naturally weakens with age. If hormone therapy is used without proper monitoring, it can cause harmful changes in the body without being noticed. For example, you may feel aching in your calves while walking, see more visible blue veins, or feel pins and needles while resting, small signs that deserve serious attention. So what's the solution? Not everyone needs to stop hormone therapy immediately. For many women, these treatments provide meaningful improvements in quality of life. But it is essential to evaluate clotting risks beforehand, especially if you have a history of blood clots, obesity, smoking, or chronic conditions like hypertension or diabetes. There are also safer alternatives. For instance, using transdermal estrogen patches instead of oral pills. Some experts believe that gels or patches have less impact on circulation than tablets. It's also important to stay active daily and avoid sitting still for over 60 minutes at a time to support better blood flow. Remember, your hormone levels and blood vessels are closely linked. Sometimes, a small change like switching medication forms or adjusting your dose under medical guidance can help you maintain hormonal balance while keeping circulation healthy. If you're using hormone replacement therapy, ask yourself, have your legs been feeling more painful, heavy, or different since starting the medication? 3. Antihistamines. You might be surprised to learn that the pills you often take for seasonal allergies, hives, or itching may silently reduce blood flow in your legs. Antihistamines, including common names like diphenhydramine Benadryl, loratadine Claritin, or cetirizine Zyrtec, are widely considered safe and are found in most household medicine cabinets. However, when used over long periods, especially in middle-aged or older adults, side effects may appear without you noticing. One of those effects is the narrowing of peripheral blood vessels. While the main action of antihistamines is to calm allergic reactions by blocking histamine, they may also indirectly affect the autonomic nervous system. This can lead to mild vasoconstriction, especially in areas like the feet or calves where blood flow is already limited. A study from McMaster University in Canada reported that patients using older generation antihistamines had lower skin temperature in the lower limbs compared to those not using the medication. This suggests a reduction in the blood supply to the legs, although not immediately dangerous. This condition can worsen over time, especially if combined with other risk factors such as diabetes, high blood pressure, or a sedentary lifestyle. You might notice subtle signs, colder legs, numbness when sitting for a long time, or patches of dry, thin, slightly bluish skin near the ankles. These signs are often ignored by seniors who think they are normal signs of aging. But in reality, your body may be signaling a biological change that needs attention. If you are regularly taking antihistamines, especially older types with sedative effects, you may want to consider switching to newer generation options that are less likely to affect the nervous system. You could also try natural ways to reduce allergies, such as using an air purifier at home, rinsing your nose with saline, or drinking warm ginger tea in the morning to help clear histamine from your digestive system. Whether it's allergy medicine or heart pills, remember this: everything you put into your body can affect your circulation in ways you might not expect. If your legs often feel cold, tired, or numb, and you're taking antihistamines regularly, now may be a good time to talk with your doctor about finding a better option. 4. Antidepressants, SSRIs, TCAs, and SNRIs. If you or a loved one is receiving treatment for mood issues such as anxiety, insomnia, or depression, you may be familiar with medications like sertraline Zoloft, amitriptyline, or venlafaxine. These are antidepressants belonging to groups such as SSRIs, selective serotonin reuptake inhibitors, TCAs, tricyclic antidepressants, and SNRI, serotonin norepinephrine reuptake inhibitors. While these drugs are highly effective at improving mental health, there's a lesser-known truth: some antidepressants may negatively affect circulation, especially in the lower limbs. Biologically, these drugs work by adjusting neurotransmitters in the brain such as serotonin and norepinephrine. However, these same chemicals also help regulate blood vessel tone and overall blood pressure. When serotonin levels become too high in the bloodstream, the blood vessels may constrict, reducing the amount of blood reaching areas farther from the heart like the calves and feet. A report from the Journal of the American Medical Directors Association revealed that among older adults taking SSRIs, 17% reported frequent cold feet, numbness, or a tingling sensation in the toes. Some also experienced blood pressure changes and dizziness when standing up too quickly, clear signs of poor circulation. This is especially true for tricyclic antidepressants like amitriptyline. These are sometimes prescribed for nerve pain or fibromyalgia in older patients, but they can strongly affect heart and peripheral circulation. Those with underlying heart or vascular conditions are more vulnerable. If you're taking these medications and notice unusual coldness in your feet, fatigue in your legs, or skin turning pale or grayish, take it as a gentle warning from your body. Do not stop the medication suddenly, as that can cause serious psychological and neurological side effects. Instead, talk to your doctor to review your dose or explore alternatives with fewer effects on circulation. Some people may be advised to reduce their dose gradually or combine medication with non-drug therapies such as counseling, meditation, or gentle physical activities like morning walks or senior-friendly yoga. These small steps can improve your mood without negatively impacting blood flow in your legs. If your mood has improved, but your legs feel weaker or colder, especially at night, don't assume it's just aging. It might be a subtle side effect of your medication. Your body is speaking, and you have every right to listen and make adjustments. 5. Strong diuretics. You may have heard the term water pills. This is the everyday name for diuretics. These drugs are often prescribed to people with high blood pressure, heart failure, edema, or kidney disease. Common names include furosemide Lasix, hydrochlorothiazide, HCTZ, and spironolactone. Their job is to flush out excess water and salt through urine, reducing pressure on the heart and blood vessels. But here's what many don't realize: long-term or improper use of diuretics can upset your body's electrolyte balance and reduce the amount of blood reaching your legs. Here's how it works when your body loses too much sodium, potassium, and water. The total volume of blood circulating in your system decreases. That means there's less blood available to nourish distant parts of your body, especially your legs, which are already far from the heart and face gravity pressure when you stand or walk. A study from Tufts University in the United States found that patients taking high doses of diuretics for chronic heart failure had a 30% higher risk of reduced blood flow to the legs compared to those who didn't take the medication. In older adults, even mild but prolonged dehydration can reduce the flexibility of blood vessels, making circulation less efficient. You might find yourself getting more leg cramps, especially at night. Your legs may feel tight, numb, or unstable. These recurring pains can keep you awake or make you fear walking too much during the day. These are classic signs of low potassium, magnesium, and hydration, 3 key ingredients for healthy muscles and circulation. So what can you do if you must take a diuretic? First, have your electrolyte levels checked regularly, especially potassium and magnesium, through blood tests in some cases. Your doctor may prescribe potassium-sparing medications or adjust your dosage to reduce side effects. You can also support your body by eating potassium-rich foods such as bananas, avocados, sweet potatoes, and spinach. Drink water regularly throughout the day, but in small amounts each time to avoid overloading your heart. Gentle leg stretches before bed and soaking your feet in warm water with ginger or sea salt can also help improve circulation. Most importantly, do not ignore symptoms like leg fatigue, cramps, or numbness. These are your body's way of saying it's time to review your medication plan with your doctor's help. You can safely adjust your treatment to protect both your heart and the healthy blood flow to your legs. As you can see, some of the most common and often essential medications can quietly impact blood circulation in your legs if we don't pay attention. From beta blockers for heart health, to seemingly harmless allergy pills, to hormone replacements for menopause, they can all cause small but meaningful changes in how blood flows to your lower limbs. Recognizing the link between your medication and symptoms like cold legs, cramps, numbness, or walking discomfort is the first step towards smarter, more proactive healthcare. Sometimes, just one doctor's visit to review your prescriptions or writing down unusual symptoms during the week can help identify a hidden problem much sooner. You don't need to change everything at once. Start small. Read your medication labels carefully. Ask your doctor or pharmacist about circulation-related side effects. Pay attention to how your body responds. And above all, listen to yourself. If you are taking one of the medications we mentioned, don't be alarmed. This video is not here to scare you, but to empower you with knowledge. Every person is different, and when you understand what's happening inside your body, you can make the best choices for your health. I hope today's information helps you better understand the importance of tracking medication side effects on leg circulation. If you found this helpful, please like and subscribe to the channel so you don't miss our upcoming videos. We will continue to bring you practical, science-backed information in simple, easy-to-understand language to support your health journey. Which of these medications are you taking right now? Have you experienced cold feet, tingling, or cramps without knowing why? Leave a comment below and share your experience. I'm always ready to listen, and your story could inspire or help someone else facing the same issue without even realizing it. Wishing you good health, strength, and steady circulation. See you in the next video.